When I talk with patients about different types of fillers, one of the fillers I like to discuss with the right patients is something called Sculptra. Now, Sculptra is a polyl-lactic acid. And what that is it's a micronized version of that. It's a form of actually absorbable suture material that we use in surgery. And it is used to help revolumize a face. So the patients that are best suited for this are patients that really have a decrease in the amount of volume in the face. Sculptra is different than other fillers. It's not a hyaluronic acid filler, which is the most common type of filler. And it's one that requires a few sessions of treatment to get the full effect. However, it has the longest lasting effect and treatment changes for patients out of all of the different fillers. It'll last a good couple years for most patients. You do it in these treatment sessions and you see an effect right away. Some of that effect goes away as your body absorbs the saline that the Sculptra was mixed with. However, that material stays behind and starts to stimulate the collagen production underneath the skin. That's what accounts for the long-lasting effect. Eventually, the material itself is going to be absorbed, but the effect that it's had on the collagen-producing cells is long-lasting. And that's why it's such a great filler option for those patients who truly need revolumization of the entire face and not just one area. The patient that I feel does the best with treatments of Sculptra is a patient that truly needs revolumization of the entire face, not just one specific area that we're trying to fill, but really the anterior portions of the cheek, the lateral portions of the cheek, some of the areas, other areas might be up into the temples. Those patients are going to do the best overall with treatment from Sculptra.